Welcome to OET Answers.
Occupational English Test. OET Answers Practice Test, Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. You hear a GP talking to a patient called Susie Kin. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, Susie Kin. How can I help you today?
Morning, Doctor. I've been feeling really off lately and I'm a bit worried. I'm not sure if it's something serious, but I've been extremely tired and I've noticed a few weird things happening with my body.
I see. Let's take a closer look at what's been going on. How long have you been feeling this way?
It started about 3 months ago, I think. At first, I thought it was just stress from work. I'm a teacher, and it can be really draining sometimes. But it's been getting worse, not better. I'm tired all the time, and now even the simplest tasks leave me exhausted.
That sounds exhausting. Aside from the fatigue, have you noticed any other symptoms?
Yeah, there's a few things. I've been getting these bruises, and I can't explain them. I don't remember hitting myself, but they just keep appearing. They're dark too, and my gums bleed a bit when I brush my teeth, but I just thought it was my toothbrush being too hard or something.
Unexplained bruising and bleeding from the gums can sometimes point to underlying issues. Have you had any infections recently, maybe colds or more severe infections that you don't usually get?
Actually, yeah. I've had 2 colds in the past couple of months, and I don't usually get sick that often. The second one took forever to go away. I just felt run down the entire time.
Any fevers or night sweats?
Well, not fevers, but I've been waking up in the middle of the night drenched in sweat. I didn't really think it was anything serious, maybe just stress or bad dreams. But it's been happening more often, and now I wake up tired too.
And how's your appetite been? Have you noticed any changes in your eating habits or weight?
Actually, now that you mention it, I've lost some weight, but not intentionally. I'm eating less, and I just don't feel as hungry as I used to. It's weird, because I've always had a pretty good appetite.
That's quite a range of symptoms. How's your energy during the day? Are there times when you feel better or worse?
It's pretty much all the time now. At first I thought I was just tired because of work, but even on weekends or after a good night's sleep, I feel completely drained. Like walking up the stairs or even carrying a bag of groceries makes me feel winded.
That's definitely something we need to investigate further. Have you noticed anything unusual with your skin or complexion? Maybe paleness or changes in skin texture?
Yeah, I've actually been getting comments from friends and colleagues about how pale I look. I just assumed it was because I'm not getting enough sun lately.
Right. And have you had any joint or bone pain? Maybe aching in your limbs or back?
Now that you mention it, I've had this dull ache in my legs, especially in the mornings. It's not unbearable, but it's definitely there. I thought it was just from sitting too much at work.
Have you had any other medical conditions in the past, or anything in your family history that could be relevant?
No, nothing that stands out. My family's generally pretty healthy as far as I know. I haven't had any major illnesses either, just the usual colds and minor stuff.
Okay, Susie Kin, based on what you've described, the fatigue, unexplained bruising, night sweats, weight loss, and paleness, these symptoms could potentially point toward a blood disorder. One condition we'll need to consider is leukemia. Have you ever heard of it?
Leukemia? I've heard of it, but I thought that was a type of cancer. Could I really have something like that?
Leukemia is a type of blood cancer that affects the bone marrow, where blood cells are produced. It can cause many of the symptoms you're experiencing, like fatigue, bruising, and recurrent infections. Of course, we can't jump to conclusions, but your symptoms align with some of the warning signs, and it's important to rule it out or diagnose it early if that's the case.
Wow, I didn't think it could be something that serious. What would happen next if you think it's a possibility?
The first step would be to run some blood tests. We'll check your complete blood count (CBC) to see if there are any abnormalities in your white or red blood cells as well as your platelets. If anything unusual comes up, we may need to refer you to a specialist, such as a hematologist, for further tests like a bone marrow biopsy. But let's take it one step at a time.
I didn't realize blood tests could show all of that.
Yes, they're very effective in helping us understand what's happening inside your body. If there is something like leukemia, catching it early can make a big difference in treatment outcomes. But remember, there are other conditions that can cause similar symptoms, so this is just one possibility.
Okay, I understand. It's a lot to take in, but I'm glad we're looking into it. What do I need to do now?
Extract 2, questions 13 to 24. You hear a doctor talking to a patient called Mr. Gerald. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good afternoon, Mr. Gerald. I'm Dr. Wells, standing in for Dr. Whitfield today. I understand you're here to follow up on a concern regarding your chest area. Could you tell me a bit more about what's been bothering you?
Yeah, thanks for seeing me. It's just my chest. I noticed a couple of months ago, maybe 3 or 4 months, that it's gotten, I don't know, puffier. It feels strange, like there's more tissue there, and it's a bit sensitive.
I see. Has the sensitivity gotten worse over time, or does it come and go?
It kind of comes and goes. Sometimes it's tender, especially when I press on it or bump into something, but mostly it just feels like there's more tissue than usual. It's mainly around the nipples.
Right. I can understand how that might feel concerning. When you say more tissue, do you mean swelling or does it feel more solid like a lump?
Not like a lump exactly. It's just fuller, kind of softer. I googled it a bit and it seems like it could be something called gynecomastia, but I'm not sure.
You're correct that gynecomastia is one possibility. It refers to an increase in the glandular tissue of the male breast, and it's not uncommon. A lot of factors can cause it, ranging from hormonal changes to certain medications or even lifestyle factors. Have you noticed any changes in your health or habits lately?
Not really, nothing major. I mean, I've been trying to get into better shape, eating healthier and hitting the gym a bit more. Could that be related?
Exercise and diet are great, but they typically wouldn't cause gynecomastia. However, some changes in body fat can make the condition more noticeable. Have you experienced any significant weight loss or gain recently?
I've lost a bit of weight, but not a lot. I also had to change up some meds. I was on a new antidepressant a few months ago, but I didn't really like how it made me feel, so I stopped.
Medications, particularly antidepressants, can sometimes contribute to this type of breast tissue development. I'll make a note of that. We'll want to take a closer look at your overall health profile, including the medications you've been on. Have you noticed any other changes, like weight gain around the abdomen, fatigue, or any mood changes?
Not really. I've been a bit more tired, but I figured that's just stress. It's been a rough year.
Understandable. Stress can impact the body in many ways, but it's also worth considering your hormonal balance. Sometimes, gynecomastia is linked to an imbalance between testosterone and estrogen. Have you had any blood tests recently to check hormone levels?
No, nothing like that. Do you think I need one?
I think it would be a good idea. It's important to rule out any underlying issues like low testosterone or higher than usual estrogen levels, both of which can contribute to breast tissue growth in men. Along with that, we might look at your liver function, as liver health can affect hormone balance.
All right, that makes sense. Is this something that's going to go away on its own, or will I need treatment?
It really depends on the cause. If it's related to hormonal changes, particularly if those changes are temporary or related to a medication, it could resolve on its own over time. However, if it persists, or if the tissue continues to grow, there are treatment options. Have you heard of any treatments for gynecomastia?
I saw some stuff online about surgery, but that seems like a last resort.
You're right. Surgery is usually reserved for cases where the condition doesn't improve or causes significant discomfort. Before we even consider that, there are other non-invasive treatments, including medications that can help balance your hormones. However, we'd first want to get those test results back to pinpoint the cause.
What kind of meds would that be? Are there side effects?
Depending on the hormone levels, we might use medications like tamoxifen or anastrozole, which can help reduce breast tissue in some cases. They're more commonly used in cases where the gynecomastia is due to an imbalance of estrogen. As with any medication, there can be side effects, but we'll weigh those against the benefits.
Okay. I'd prefer not to go down that road if I don't have to, but I'll do what's needed.
That's understandable. For now, the most important thing is to get a full picture of what's going on with your body. I'll order some blood tests, and once we have the results, we can talk through your options.
Sounds good. Should I be worried about anything more serious, like cancer?
It's natural to have that concern, but breast cancer in men is quite rare. Gynecomastia itself doesn't increase your risk, but we'll keep an eye on anything unusual, such as a hard lump, skin changes, or discharge from the nipple. If you notice anything like that, let us know right away.
I haven't noticed any of that, so that's a relief.
That's good to hear. Let's get those tests done, and we'll go from there. In the meantime, keep doing what you're doing in terms of staying active and eating well. If you notice any changes or discomfort, don't hesitate to come back in.
I will. Thanks, Dr. Wells.
You're welcome. We'll be in touch as soon as we have the results. Take care, Mr. Gerald.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a neurologist explaining about acute stroke patients. Now read the question.
When it comes to treating acute stroke patients, time is everything. The faster we act, the better the chances of recovery. For example, if we can administer clot-busting drugs within the first 3 hours of a stroke, the likelihood of avoiding long-term damage increases significantly. In some cases, we have up to 4.5 hours, but the earlier, the better. Every minute counts because the brain loses millions of neurons each minute blood flow is restricted. By contrast, in non-urgent cases of stroke risk management, like with patients who have transient ischemic attacks, TIAs, the urgency is lower. But for acute strokes, delays of even 10 to 15 minutes can drastically affect outcomes. This is why we emphasize getting patients to the hospital as quickly as possible and starting treatment right away. Most stroke patients we see tend to be older and have underlying conditions like high blood pressure or diabetes, which put them at higher risk for complications. The critical window for intervention narrows quickly, so making every second count is key to improving recovery outcomes.
Now look at question 26. You hear a nurse briefing a colleague during a shift change. Now read the question.
Medications and responding to patient calls. Mrs. Jordan in bed 3, who had a knee replacement surgery, mentioned waiting 30 minutes for pain relief last night. Mr. Lee in bed 8 needed assistance to the bathroom but had to wait as well.
That sounds concerning. Any serious patient safety issues so far?
Not yet, but we're definitely seeing some dissatisfaction from patients. The recovery process could be affected if we don't address this. I think we need to escalate this to management.
I agree.
Meanwhile, can you make sure Mrs. Jordan gets her pain relief on time this evening and follow up with Mr. Lee regarding his mobility needs? Also, we should document these delays and discuss them at the team meeting tomorrow.
Got it. I'll make sure to do that.
Now look at question 27. You hear two colleagues talking about a session. Now read the question.
No, it hasn't. Which is a bit surprising since we made sure all the students were aware of the sessions. We even changed the schedule from 1 4-hour session to 2 shorter, 2-hour sessions, thinking that would fit better with their busy routines. But for some reason, that didn't work either.
The interest in the time management workshops for healthcare students hasn't really taken off. And I don't think the length was the issue. I suspect that once students fully grasp the importance of time management and how it ties into their clinical placements and coursework, we might see a shift in their interest.
Exactly. There's definitely a need for it, even though the students don't seem to recognize that yet.
Now look at question 28. You hear a GP talking to an endocrinologist. Now read the question.
Hello, Dr. Thompson. Do you have a moment? I have a patient I'd like your input on.
Sure, go ahead.
I have a 55-year-old male patient who was diagnosed with prediabetes last year. His blood sugar levels are still in the prediabetic range, and he hasn't shown any signs of complications so far. He's asking if he should be screened for any diabetes-related complications, such as kidney or eye issues. I'm wondering if it's necessary at this point.
Well, current guidelines recommend that people with prediabetes, especially those over 50, should be monitored regularly for early signs of complications. Even without a full diabetes diagnosis, there's an increased risk of complications like retinopathy or nephropathy. If your patient is concerned, it's a good idea to start screening.
Now look at question 29. You hear a dermatologist explaining eczema. Now read the question.
I see that you've been experiencing more frequent eczema flare-ups lately. You've made some positive lifestyle changes, and while diet and stress can influence your skin, it doesn't seem like those are the primary causes here. Eczema is often triggered by external factors like changes in the environment or irritants, but in your case, the most likely explanation is the change in your skincare routine. You mentioned starting a new moisturizer, which contains ingredients that can sometimes aggravate sensitive skin. Additionally, you stopped using the medicated cream that had been helping to control the flare-ups, which could also be contributing to the worsening of your condition.
Now look at question 30. You hear two radiologists discussing imaging options for a pregnant patient with abdominal pain. Now, read the question.
GYN department. They have a 32-year-old pregnant woman, about 20 weeks along, with persistent abdominal pain. They're concerned it could be something serious, and they want to order an abdominal CT to rule out any complications.
Do you think that's the best choice in this case?
I was thinking we should recommend an abdominal ultrasound first, given her pregnancy, to avoid radiation exposure.
Good point. Is there any concern about using ultrasound instead of a CT? I'm thinking in terms of diagnostic accuracy.
Ultrasound sensitivity in pregnant patients is generally good, though not as high as a CT for certain conditions. However, in this case, we could also consider an MRI, which provides excellent detail without the radiation.
Ah, right. MRI would avoid both radiation and contrast risks. But if we don't get a definitive answer from the ultrasound or MRI, what's the plan?
If we can't fully assess the cause of her symptoms with the ultrasound or MRI, we can consider a CT, but only as a last resort if absolutely necessary.
That sounds reasonable. Let's avoid the risks associated with radiation and try the safer options first. Let them know we'll proceed with an ultrasound and MRI, and we'll re-evaluate if needed.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For question 31 to 42nd, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Extract 1. Questions 31 to 36. You hear an interview with Mrs. Jess Allen, a sustainability officer and registered nurse. You now have 90 seconds to read questions.
Hi everyone, today we're here with Mrs. Jess Allen, a sustainability officer and registered nurse working with the National Nurses for Climate Action. She has been instrumental in implementing eco-friendly practices within hospitals and nursing care centers across the country. She began her career in general nursing, but shifted her focus to environmental health about 5 years ago. Mrs. Allen, could you start by telling us what initially inspired you to work towards sustainable practices in nursing?
Of course. I've always been passionate about environmental issues, but I didn't initially connect it with my career in healthcare. Over time, though, I began to see how wasteful many common healthcare practices are, especially in hospitals. I wanted to work on ways to minimize this waste while maintaining quality care.
and I saw there was a real need for advocates within healthcare who understood both nursing and environmental sustainability.
That's such an important perspective. In your experience, what are some of the biggest environmental challenges that hospitals currently face?
I think one of the biggest challenges is the amount of single-use items we rely on daily, things like gloves, syringes, and other disposables that we discard after just one use. It's understandable from an infection control standpoint, but it's not always necessary to be so waste-heavy. Another issue is energy consumption. Hospitals run 24/7, and they consume enormous amounts of energy. Reducing energy use and moving towards renewable sources is crucial to make a significant impact.
Absolutely, reducing waste and energy use are critical. How do you think nurses can help tackle these issues?
Nurses can play a huge role. First, we can advocate for the use of reusable items whenever it's safe to do so. For example, some facilities are switching to reusable gowns or equipment, which can dramatically reduce waste. We can also help by promoting better waste separation, sorting recyclables, compostables, and hazardous waste correctly. Finally, nurses can educate both patients and staff about sustainable practices. Small things like encouraging patients to bring their own reusable water bottles instead of using single-use plastic can add up.
Interesting. I'd imagine that could be challenging to implement across a whole facility. Are there other barriers you encounter when promoting eco-friendly initiatives?
Yes, definitely. One of the main barriers is cost. Sustainable items often have a higher upfront cost, even though they save money in the long run. Another challenge is the resistance to change. Many healthcare workers are used to certain protocols and don't want to disrupt routines that have been in place for years. But through education and leadership, we're slowly making headway.
That's encouraging to hear. I know the topic of green practices is gaining attention, but are there specific changes you'd like to see at the policy level to make eco-friendly practices more common?
Definitely. For instance, I think more hospitals should adopt comprehensive sustainability policies that mandate waste reduction targets and incentivize renewable energy sources. We also need more research into eco-friendly products specifically designed for healthcare, as well as funding for training programs focused on sustainability. Lastly, I'd like to see hospitals develop partnerships with local recycling and composting facilities to ensure waste is managed responsibly.
Those sound like impactful changes. Now, one last question before we wrap up. What do you think the average person, whether a patient or healthcare worker, can do to support these eco-friendly goals?
For healthcare workers, it's as simple as staying mindful of resource use, turning off lights and equipment when they're not needed, for example. For patients, bringing reusable items and opting for digital paperwork instead of paper can help reduce waste. It's all about creating a culture of sustainability where everyone plays a part, however small.
Thank you so much, Mrs. Aylan. This was really insightful, and it's great to see how sustainability can be integrated into healthcare.
Thank you for having me. I hope this encourages more people in healthcare to think green. Extract 2. Questions 37 to 42. You hear a presentation by a specialist in medical communication called Dr. James Hawthorne. Now read the questions. You now have 90 seconds.
Hello everyone, I'm Dr. James Hawthorne, a specialist in medical communication, and today I'd like to talk about one of the most important yet sometimes overlooked aspects of healthcare: empathy in physician-patient communication. Many of us know that clinical expertise is crucial, but empathy plays an equally significant role in patient outcomes, treatment adherence, and overall satisfaction. My goal today is to help us understand why empathy is vital in healthcare and explore ways to improve this skill in medical professionals. So, why is empathy so important? Empathy involves not just understanding what the patient is going through, but also being able to communicate that understanding back to them. It's about connecting emotionally with the patient, validating their feelings, and acknowledging the psychological and social factors that can affect their health. When patients feel heard and understood, they are more likely to trust their physician, share important information about their condition, and follow prescribed treatments. Research has shown that empathy can directly influence clinical outcomes. Studies suggest that patients who perceive their physicians as empathetic are more likely to adhere to treatment plans, report fewer symptoms, and experience better recovery outcomes. For instance, in one study of patients with diabetes, those who rated their doctors as empathetic had better control of their blood sugar levels over time. This is likely because patients who feel supported are more motivated to manage their conditions and maintain healthier behaviors. However, empathy isn't just beneficial for patients, it's also essential for doctors. Physicians who practice empathy tend to have higher job satisfaction and lower burnout rates. In a profession where emotional stress is high, maintaining an empathetic approach can help doctors feel more fulfilled in their work. It also fosters better communication within healthcare teams, improving collaboration and patient care. Despite the clear advantages, one of the challenges we face is that many medical professionals struggle to consistently express empathy. This is especially true in high-pressure environments like emergency rooms or busy clinics, where time constraints and the need to make quick decisions can make it difficult to engage with patients on an emotional level. As a result, many patients report feeling rushed or dismissed, which can undermine the trust in the physician-patient relationship. So how do we ensure that healthcare professionals can develop and maintain empathy, even in stressful situations? One solution is training. Medical schools and hospitals are increasingly recognizing the importance of communication skills training that includes empathy development. These programs often use role-playing exercises, where physicians practice patient encounters in controlled environments, receiving feedback on how well they listen, express understanding, and respond to patient concerns. There is also an increasing emphasis on reflective practice, where physicians are encouraged to reflect on their interactions with patients and consider how they can improve their approach. Another approach involves the use of mindfulness techniques to help doctors remain present in the moment, even when under stress. Mindfulness training helps medical professionals tune out distractions, focus on the patient in front of them, and respond to the emotions expressed by the patient. This not only improves the patient's experience but also allows physicians to feel less overwhelmed by the many demands of their job. There's also the importance of creating a healthcare environment that supports empathy. Hospitals and clinics can foster a culture of empathy by promoting teamwork and encouraging staff to prioritize patient-centered care. This might involve adjusting schedules to allow physicians more time with patients, or providing support staff who can handle administrative tasks so doctors can focus on patient care. Technology, while often seen as a barrier to human interaction, can also play a role. Some healthcare systems are exploring ways to use electronic medical records to flag patients who might be experiencing distress, prompting physicians to take a more empathetic approach during consultations. Moreover, empathy in healthcare goes beyond the one-on-one interaction between doctors and patients. It extends to the way healthcare systems treat patients overall. For example, hospitals that are designed to be more comfortable and patient-friendly, with spaces that promote relaxation and well-being, can enhance the healing process. Patient satisfaction often improves when the physical environment reflects an understanding of their emotional needs, and this ties back into the broader concept of empathy in healthcare. In conclusion, empathy is not an optional extra in healthcare. It is a core component of effective medical care. It enhances patient outcomes, strengthens the physician-patient relationship, and contributes to the well-being of both patients and doctors. While challenges such as time pressures and stress exist, there are clear strategies that can help integrate empathy more fully into healthcare practice. By prioritizing empathy training, fostering supportive environments, and encouraging reflection, we can ensure that physicians are better equipped to connect with their patients on a deeper level, leading to improved outcomes for everyone involved.
That is the end of Part C. You now have 2 minutes to check your answers.